Here's what I want you to hear. When a hospital makes serious mistakes, the instinct of that institution is to protect itself. That's not me being cynical. That's a documented pattern that happens in VA facilities and in private hospitals alike. So, what happens when they start closing ranks? Records somehow don't tell the full story, or key details are missing. Test results and follow-ups fall through the cracks. Requests for answers are redirected, delayed, or never fully addressed. And then patients and families are left trying to piece things together while caring for someone they love. And over time, they become overwhelmed, worn down, and they give up. That's not an accident. I didn't give up, and I was eventually able to get Todd's death certificate amended to reflect the brain injury. I suspect a lot of people have no idea you can do that. You can. And in cases like this, it can be the difference between receiving the benefits you or your family are entitled to and receiving nothing. Here's the bottom line. Todd was strong and healthy and 60 years old with a genuinely promising outlook. He chose the VA because he believed in it. He trusted it with his life. He had gotten through the hardest part of his treatment thanks to a top-notch oncology team. What happened to him was not bad luck, and it was not inevitable. It was a system-wide failure of communication and documentation across multiple teams over multiple months. And when that failure came to light, the institution did everything it could to avoid being accountable for it. The whole experience was deeply personal and traumatic, outrageous, and it felt like betrayal. But I don't want anyone to think our story is unique. It isn't. Listen, if it could happen to Todd with everything I know, it can happen to anyone. And it is happening to veterans and their families every single day. That's what Second Watch is about. My goal is to help veterans and their families become stronger, more informed advocates, whether they're speaking for themselves or for someone they love. Because in a system as complex as the VA, knowledge isn't just power. It's often the difference between being dismissed and being taken seriously. One of the last things my husband said to me when he could still speak was, "Talk to the VA. They'll help you. I earned it." He was right, but they didn't, and they should have. They're required to. In May of 2025, I settled my lawsuit with the Seattle VA, but they never formally acknowledged the truth about what they did. So, did it change anything? Listen, the Puget Sound healthcare system treats 160,000 veterans every year. On paper, the VA's national quality metrics look comparable or better than private hospitals. But those metrics only measure what gets reported. Veterans often have no alternative healthcare options, limited legal recourse, and real fear of retaliation when they speak up. That means the official data probably doesn't reflect the full picture of harm inside the VHA. The fact that Seattle VA leadership could effectively conceal and minimize the events that occurred while Todd was in their care, and that the VA leadership in DC allowed it, means that every single veteran that walks in the door is at risk, whether in Seattle or in any other VA hospital. And I won't stop talking about that. I'm going to share what I've learned about navigating VA care and knowing your rights and fighting for them when the system lets you down. I'll talk about how to understand medical records and how to recognize when something has gone wrong and what to do when the hospital tells you nothing did. I'll talk about patient safety, informed consent, and not just informed, but smart decision-making, proper documentation, hospital procedure, VA policy, resources, and all the things an advocate needs to know to be effective. You deserve to have someone in your corner who actually understands how this works. That's what Second Watch is here for. The reality of healthcare today in any hospital is that quality of care depends on active participation by patients, their caregivers, and their advocates. You are the Second Watch.